Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Stephen Morrison, a global health policy expert at the Center for Strategic and International Studies, a Washington, D.C. think tank. They discuss Russia, where officials are ready to use a COVID-19 vaccine before completing testing for safety and effectiveness. Let's listen.
Stephen Morrison, thank you so much for joining me.
Thank you. Glad to be here.
So I know you've done a lot of work on Russia and its response to COVID-19. I wanted to start with what we've been hearing about Russia having a vaccine that's ready to go. Could you talk to us a little about that and why we might want to be concerned?
Thanks. Yes, well, this is a big story of the week. It's been building for a couple of months. It starts with President Putin. This is certainly his endeavor. It's driven by him. This effort at trying to win the race for a vaccine for both people in Russia, but the world's population. It's a prestige geostrategic gambit by the Russians. It involves a vaccine that is an adenovirus viral vector vaccine. It went into phase 1, phase 2 trials about 8 weeks ago, estimated around 76 people in those first early trials. No data has been published from this. Nothing has been shared. There has been no phase 3 trials, which would be the normal high volume trials before you would reach some judgment as to safety and efficacy. What has distinguished the Russian effort and caused a lot of controversy is the announcement that by Putin and by his authorities this week that they were going to register the vaccine for use both within Russia and outside. Before there's been phase 3 trials, they're beginning to give this to doctors, to health workers, and soon to teachers and to the military, and they're going into mass production, and they're intending to begin in October a mass distribution within Russia. And they've announced that they are striking deals. They're in discussions with a number of other countries. They claim they have letters of application or expressions of interest from 20 countries amounting to 1 billion doses of this. They've specified certain countries, the Philippines, Saudi Arabia, UAE. They're also announcing that there will be some form of field trials in several of these countries and the like. The reason this is, of course, sparked controversy is because it is a shortcut. It is rushing ahead without any shared proof of the scientific data demonstrating safety and efficacy, and simply signaling, well, trust us. And they're making this argument that because this builds off of earlier vaccine platforms developed for MERS and SARS, 2 other coronaviruses, that those, in their estimation, worked well, although they never really got certified internationally. They remained candidate vaccines, in the words of WHO, that's good enough. And so they're charging ahead. I think the motivations behind this are multiple. There is an internal motivation, which is that Putin needs a big win for his own position within Russia. His economy's on its back. He can't deliver on the big promises he's made for mega-dollar big public infrastructure projects. His popularity is at an all-time low. His mishandling of the coronavirus, the COVID-19 outbreak within Russia, has damaged his standing. The program, there's roughly 900,000 cases that they acknowledge, about 16,000 deaths. Those numbers are thought to be undercounts, significant undercounts. So he is looking for a win. He's looking for a win domestically. I think that's a very strong motivation. He's looking for a win outside in terms of being able to reach outside and build alliances and be seen as the first and appeal to countries that may feel like they're going to be left out by the other big competitors in this race, which are the United States and China. So he's appealing to countries that are middle income, lower income, and saying to them, look, we may put manufacturing facilities in, we may have licensing arrangements, we may give you cut prices, or this may come for free. And so they're out marketing this as a way of building prestige and alliances and the like. People are worried about this because it is putting an unproven product out on the market. It could be substandard. It could be dangerous. It could do lots of harm. There's a lot of concern that the usage of this by teachers, by the military, by health workers could be coerced and not be voluntary. Mm-hmm. I think we should expect that there's a high risk of this entire thing backfiring. If it turns out to be unsafe, to have adverse effects, they're going to have a difficult time covering those up. They may try to cover them up within Russia. They're going to have a difficult time doing that if it's in Brazil or Philippines or Saudi Arabia. If it backfires, it does damage not just to Russia's reputation. It aggravates an already really complicated situation globally where trust in vaccines is compromised, lots of hesitancy, lots of wariness we see in poll after poll after poll. This could worsen that, this image that people are bending the rules, they're letting politics dominate science, they're putting people's well-being at risk in order to achieve some sort of political end. So it is a very dramatic, don't doubt that Putin is using everything in his power to move this forward. There's a very elaborate, slick, polished website, 7 languages that was rolled out yesterday. He has brought in his own military medicine, which is formidable. He's brought in the Gamaleya Institute. He's brought in the health ministry, the trade ministry, obviously his own person in his own office. He's brought in the Sovereign Wealth Fund, the Russian Direct Investment Fund, to finance all of this. And the propaganda machine is on full tilt. I mean, if you've been in Moscow in the last 2 months, it's been nonstop propaganda. And they have done a very good job at sort of getting their messages out. But they're going to meet with resistance. They're meeting with significant resistance within Russia, from within the general population, which is showing upwards of a third don't trust Putin and are not going to be responsive to the propaganda and are not going to accept the vaccine on a voluntary basis. You have industry. You have the Association of Field Trials Organizations, Research Trials Organizations, which includes some of the big super, multinationals, the Pfizer, Bayer, AstraZeneca, Novartis. They have come out and been very vocal on record saying you should not move ahead in this fashion until there are completed successful phase 3 field trials and the results are published. So there is resistance.
Is the reason they're in such a hurry because they want to be first and they want to be able to claim this?
Absolutely.
As a big win?
I think Putin has judged that he needs a big win domestically, and he wants, on the international side, he wants to be out in front of the United States and China, and being able to come forward and claim, look, I got there first. Mm-hmm. Trust me, this is going to be safe and effective. And I can get it to you at a cheaper basis, quicker than the Chinese and the Russians. And I can help you get out from underneath this pandemic and the economic crisis it's created and the social instability that it's created. So it's a drive towards that kind of prestige. And he's playing on the history of Russia, right? He's calling it Sputnik 5. So that harkens back to 1957 to the satellite telemetry, the first satellites put into orbit, a moment of historical prestige. He's also harkening back to the glory days of Russian immunology, virology, science during the Soviet era, the bioweapons effort, which is a dark period, but also the heavy investment in their science infrastructure on virology. Now, much of that has been degraded and weakened in the last 10 or 15 years, and it's a bit of a stretch to be claiming this reality today. But nonetheless, they're invoking that and trying to basically make the argument that their science is on par, on track. Now, we do have to admit the possibility that Putin may have a product that does turn out to be safe and effective, right? Mm-hmm. In which case, if he's able to circumnavigate all the barriers he's going to face, WHO is not going to sign off on this thing. He's not going to be, many different marketplaces are going to have a lot of heartburn in thinking about adopting this, right? Brazil's going to have heartburn about this. There's certainly no Western country is going to allow this to be used on human populations without the field trials coming forward. So he's going to meet lots of resistance there. But you can imagine that he just has decided on political and geostrategic grounds, full steam ahead, and we'll deal with these problems as they come along.
If they had done all the testing, would we still have trouble trusting it?
Well, that's a very great question because, of course, they don't have a great record of transparency and reliability. They have reputational problems in this regard. People don't trust the numbers, the case counts for coronavirus cases, or the numbers on fatalities. So there is this question of by what basis are we going to judge what numbers they come forward with? So they have to disclose as much of the raw scientific data and be as transparent as possible to win trust. Now, as a point of comparison, mm-hmm. the Chinese have a very similar reputational problem in that they are regarded as cutting corners. They don't have the same field trial quality and standards. They don't record adverse events with the same level of specificity and reliability as most Western field trials. What's gone on there is some of these firms, which aspire to be globally accepted firms, there's the CanSino Biologics, which is developing an adenoviral vector very similar to the Russian one. What did they do? Well, the first 45 or whatever it was, the first phase 1, phase 2 trials, they published their results. They were not that flattering, the results. They published them in The Lancet. So they went out for full disclosure and transparency in order to say, look, we are part of a global industry with these standards. We're going to meet those standards. Quite different than what the Russians have done.
Mm-hmm. And I guess my last question is, and I think you touched on this a little, but I'd like to hear a little more. We wonder, if when they do start to be giving out this vaccine, I guess you're saying in some quarters they are, is there an option whether to have it or take it or not? Or are they going to be forced to try something that has not been studied well enough?
Well, that's a poignant question. They are moving ahead right now, beginning to give it to health workers, teachers, military. They are going to give priority to those that are elderly and underlying conditions, high-risk populations, subpopulations. We don't know. There's a suspicion that there'll be a pretty heavy level of coercion for people because you will have, if you're a teacher or you're a health provider, your job could be put on the line pretty easily by saying, look, for you to function as a teacher, as a health care provider, you got to do this as a prerequisite. Otherwise, don't show up for work mm-hmm. and, go somewhere else. So the ability to coerce people is pretty high in this situation.
Well, you have really raised a lot of issues to think about. Thank you so much for joining me.
Thank you, Steph.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.